is owned by the Minnesota Credit Union Network. We're the network for the credit unions in Minnesota, and we're their trade association. We do advocacy work for credit unions and so forth. And we started this partnership with the Mayo Federal Employees Credit Union last year, and it seems to be going very well. So very happy that you're here today in person and online. Anytime during the presentation, if you have a question, just either raise your hand or just ask as we go along online. If you want to enter it in the chat, we'd be happy to answer your questions as we go along. When you came in, you picked up a folder, and there's some materials inside. There's a book on the basics of Medicare. These materials are going to be available, I think, at the end of the session for those of you online that you'll receive. There's also my business cards in there, but there's also this form. It's called a permission to contact form. If at the end of the seminar you want to meet one-on-one with me, and there's never any cost to our services, but if you want to meet one-on-one, if you fill this out and leave it with me, we'll contact you with a follow-up email and then just ask you, when do you either plan on turning 65 or when are you going to retire and need the benefits, and then we'll connect with you at that time and hopefully be able to advise and help you in your journey for Medicare. If you're online, you're able to, at the end, we're going to have my email address and contact information, and if you want to connect in that way, just shoot me an email with that. And with that, we'll get started. So, okay, my clicker's not working. Clicker, professional term. It was working earlier. Can I just use an arrow on here?
Yeah.
Okay. That's not working either.
Huh.
There we go. Okay, thank you. So today we'll be talking about the basics of Medicare Parts A, B, C, and D. Disclosures. When you work with government programs, we always have disclosures. So currently, we represent all seven Medicare Advantage plans that are available in Minnesota, and numerous Medigap and Medicare Supplement and standalone prescription drug plans that are available. We are all licensed in several states, including, I know Mayo Clinic has locations in Florida and Arizona, where we are licensed in those states amongst several other states. So we are able to help you if you want help in that regard. Today's event is educational only. We won't have any sales taking place. But like I said, if you do want to meet at a later date, just fill out that card and we will plan a time to do that. Our agenda is going to be why would you want to use TrueLink Medicare Advisors? What is Medicare and what does it cover? The different enrollment periods and deadlines you have for that. Costs associated with Medicare. What if you decide to work past the age of 65? How does that work? And then your private insurance options. So especially in the months of October and November, you see a lot of ads if you watch television on Medicare and call our 800 number and we're going to give you the world type of thing. You can certainly do that, but those how those commercials work is they're like a gathering agency of your information, and then they're going to pass it on to an insurance company that pays them to get the leads, and they're going to call you and call you and call you. So you can avoid all of these types of things, including the direct mail, if you want to use an organization that's actually been vetted by the Mayo Employees Credit Union, which is TrueLink Medicare Advisors. We're here hopefully to help you make a decision that's going to be best for you. Welcome. We do have handouts over here if you want to grab any of that, but we've just started, so you haven't missed much. No, that's fine. Again, our services, there's never a charge for our services. If you end up signing up with a plan through us, we get paid a commission by the insurance carriers. And for Medicare Advantage plans, we get paid the same commission no matter which insurance carrier you go with. So we don't have an incentive to say, oh, Blue Cross is going to pay us X number of dollars, and UCare is only going to pay us this much. Federal government standardized commissions several years ago now, so we get paid the same no matter if you go with a Medicare Advantage plan, which plan you go with. And it doesn't matter if you go with a zero premium plan or a $200 plan, we get paid the same. So the nice thing about that is we don't have an incentive to sell you something that you don't need. We're going to walk you through the process and help you determine, do you want an Advantage plan or do you want a Medigap supplement plan? With Medigap plans, we get paid a commission of whatever your monthly premium or your yearly premium is. So that's how the commissions are paid on that. We're here to educate and consult. We're going to walk you through questions. If we meet one-on-one, we'll look up any medications that you're taking on the Medicare website to help decide which plan is going to give you the best coverage, and you're going to know your monthly costs when you go to the pharmacy, if you have a deductible, those sorts of things. And then we're available as your agent or agency. We're here throughout the year. If you have questions, I have clients calling me all the time saying, I went to the doctor or I went to the pharmacy and they charged me X number of dollars, and pharmacies make mistakes, plans make mistakes. So we're here. We can do three-way calls with your insurance carrier. We're here to help you get things straightened out if you ever have issues with that. Not everybody does. Some people do. And then every year we're going to review your coverage if you want us to, because plans can change from year to year. Prescription drug plans change, Medicare Advantage plans can change. So if you want to review your options for the following year, or if you just want confirmation that your prescription drugs that you're on this year are still going to be covered next year, we do all of that in early October, and we help you, just give you peace of mind with that. And guidance and enrollment, many of the things we'll do, when should you enroll in Medicare Parts A and B? You have well-meaning friends and neighbors who, I hear it all the time, well, I was told that if I don't enroll in Medicare Part A and B when I turn 65, then I'm going to have a penalty to pay the rest of my life. That's not true if you or your spouse is still working and you're on that employer plan. And the employer plan, if they have 20 or more employees, which if you're on the Mayo plan, obviously they do. But you can delay your Medicare Part A and B, and there's a form that the Mayo HR, Human Resource Department, will fill out for you once you are ready to either retire or to go on to Part B. And when we help you submit that form, that's what prevents any penalties down the road if you delayed enrollment at age 65. We educate you on what does Medicare cover, what doesn't it cover, working employees, if you delay your enrollment. What if you have an HSA? Do you contribute to a health savings account? How does that work? If you do contribute to an HSA, a health savings account, and you're still working, you're past the age of 65, you don't want to sign up for Medicare Part A. If you sign up for Medicare Part A, you're still working beyond the age of 65, then you're going to be either taxed on the money that you're contributing to your HSA, or basically you need to stop contributing. So there are reasons why you don't pay a monthly premium for Medicare Part A, but if you're going to continue to work and you're contributing to a health savings account, you don't want to sign up for Medicare Part A at the time you turn 65. We talk about late enrollment penalties. You aren't going to have to deal with those. Again, if you work past the age of 65, even if your spouse is on your employer plan and they're not working, but you continue to work, if you're both on the employer plan, you both can delay Medicare Parts A and B until you're ready to retire without penalties. And then we talk about guaranteed issue and enrollment periods and so forth. So, original Medicare. Any questions on that? Okay. There's two parts to original Medicare. There's Medicare Part A, which provides coverage for hospitalization, skilled nursing, home health care, and hospice care. You won't pay a monthly premium for Medicare Part A if you've worked in the United States and paid the Medicare tax. Anybody who's working in the U.S. has Medicare tax coming out of your paycheck. As long as you've been doing that for 10 years or your spouse has been, you won't pay a monthly premium for Medicare Part A. I do need to update this. The deductible, if you just had original Medicare Part A and B, the hospital deductible for the first 60 days has gone up to $1,676. And then Medicare Part B, you will pay a monthly premium for. And Medicare Part B covers doctors, specialists, outpatient things like outpatient surgery, ambulance rides, durable medical equipment, all those types of things, ambulance. That monthly premium has increased to $185 a month this year. And the annual deductible has gone up to $257. If you get a Medicare Advantage plan, you're not going to have to worry about the deductibles. If you have a Medigap plan, and we're going to talk about the differences, you may have to be concerned about the deductibles. And we'll go into that in just a little bit. So there's a lot of things that original Medicare doesn't cover. It's not going to give you coverage for comprehensive dental. You won't have worldwide coverage if you're traveling. It won't cover your routine hearing exams, fitness benefits. It won't cover your routine vision exams or your eyewear, and it doesn't cover prescription drug coverage. So you have to add on extra plans if you want coverage for these types of things. In Minnesota, Medicare Advantage plans are going to give you coverage for all of these items. Medigap plans may give you coverage for fitness benefits, but for prescription drug benefits, we would look at getting a standalone prescription drug plan. We'll go into that in a moment. So the different Medicare enrollment periods. There's the initial coverage enrollment period, and this is based around your 65th birthday. It begins 3 months before the month you turn 65, the month of, and 3 months following. So there's a 7-month window. If you're going to enroll in Medicare's Part A and B when you turn 65, there's a 7-month window to do that. Again, if you're going to continue working or your spouse is going to continue working and you have employer coverage, you can delay that. And one of the reasons you would want to delay that is you wouldn't have to pay that $185 a month premium for Part B, because if you have employer coverage, that's not going to be a big help to you to have that Medicare Part B. You really don't need that until you retire or leave your employer plan. Yes?
My wife is a male employee, and I'm under her insurance. My business covers, it pays us for her premium. Does that go when I step down, if I retire like 67, would that then would there still be the same rules apply, or do you have to be a male employee?
You don't have to be a Mayo employee. If you're, as a spouse, if you're on your wife's plan, if she's a Mayo employee, if she continues to work and you're age 65 or beyond, you can still delay your Medicare Part A and B until she retires and you both leave the employer plan.
Do you have to notify Medicare or anything like that?
You do not. There's a form I'm going to show you in a little bit. You don't have to do anything. If you're not going to sign up for Medicare Part A and B because of those reasons when you turn 65, you don't have to do anything. If you're collecting Social Security benefits at the age of 65, they're automatically going to enroll you in Medicare Part A and B. And if you don't want that coverage because maybe your spouse, you're getting coverage through your spouse's employer, there's instructions when you get your Medicare card that tells you how you can suspend your Medicare Part A and B if you choose to do that. Yeah. And then a special election period. This is based around, for those folks who work beyond the age of 65, for you and your spouse. It begins 2 months before the separation from active employment and continues for 8 months after that. However, you're probably not going to want to wait up to 8 months afterwards to get Medicare coverage if you're losing your employer coverage. So my recommendation is if you're going to be delaying Medicare until you retire beyond the age of 65, about 3 months prior to that, we can start working with you. We can get you signed up for Medicare Part A and B. We can tell them when you want the month you want your Part B to start. We submit the form from your HR department that's going to prevent any penalties for your Part B, and it's pretty seamless. It does take Social Security a little while, and there's really no consistency there. I've had people who've waited 8 weeks to get their Medicare card, and I've had other people who've got it in 10 days. So there's just not a lot of consistency from Social Security in how quickly it will move. It does tend to move a little bit faster if you go to the Social Security office Or if you're applying for Medicare Part A and B at the same time and do it online, you tend to get your Medicare card more quickly than if you already had Medicare Part A and are just signing up for Part B around your retirement date. But when that time comes, we can help you with that if you want us to. And again, there's no cost for that. And then another election period is the annual election period. This is every year for people who are on Medicare Advantage plans or standalone prescription drug plans. Every year from October 15th through December 7th, you can review other options for the next year. And if you don't like the changes that are happening to your plan or your prescription drug plan, you have the option to choose any other plan that you want beginning January 1 of the following year for Advantage and standalone prescription drug plans. Now, in Minnesota, our legislature a couple of years ago created an annual enrollment period for Medigap supplement plans. Up until now, if you didn't choose a supplement plan or a Medigap plan when you were first eligible, down the road, if you wanted one, you were going to be asked health questions. It's called underwriting. You'd be asked health questions, and if you answered yes to any of those questions, they would deny you having coverage on a Medigap plan. The Minnesota legislature changed that, and starting October of 2026, they've also created an annual election period for Medigap plans. So let's say you want to start out with a Medicare Advantage plan simply because they're far more economical, and then down the road as your health care changes, you say, you know, I want to get into a Medigap plan. In Minnesota, you're going to be able to do that starting October of next year, and you won't be asked any health questions during October 15th through December 7th. During that time frame, if you want to switch from an Advantage plan to a Medigap plan, you're going to be able to do that. So that's something that's going to be new for Minnesotans. There are a few other states that are already doing it. Most states are not, but that's going to be a benefit to Minnesotans starting the fall of next year. Any questions on that? Okay. And then one other enrollment period that Medicare created a few years back is called the Medicare Advantage Open Enrollment Period. And that's if you currently have a Medicare Advantage plan and you didn't make a switch, or you made a switch for January 1, and for whatever reason you don't like the plan that you had moving into the new year, you have one more option from January 1 through March 31st to find another Medicare Advantage plan that you can move into, or just drop it all together and go back to original Medicare. But you have one more opportunity. And the reason I don't have a lot of people who do this, but the ones who do is they find out that they didn't end up having their plan reviewed. They found out they had their plan added a deductible for their prescription drugs, or their plan's not going to cover all of their prescriptions this year that they covered last year. And so they look at other options. So it's nice to have that option if you are in that situation. So working past the age of 65, we can compare costs and benefits to what it would be if you went on to Medicare versus if you stayed on an employer plan. I've worked with enough Mayo retirees to know that in most cases, you're better off with the Mayo plan as long as you're working to keep you and your spouse on that than to move on to Medicare. It's going to depend on the plan that you chose from the Mayo, but in most cases, you're better off to keep the Mayo employer's plan until you're ready to retire. But if you want to compare apples to apples, we can certainly do that for you. Mayo's plan is deemed creditable, and that means it's as good as or better than what Medicare requires. You can apply for Part A only, but again, if you do that and you have an HSA account, health savings account, you're going to have to stop contributing to your HSA account. So if you have that, don't apply for Medicare Part A when you turn 65 if you or your spouse continue to work. When you are ready to retire, technically you want to stop contributing to your HSA account 6 months before you go on to Medicare. It's not a huge issue if you don't. You're going to get a little charge tax on your contributions up to 6 months before. If you didn't do that, it's not a huge dollar amount, but that could happen to you. Before you're ready to retire, you're going to want to apply for Medicare Part A and B. As I said earlier, we can help you with that online. You can do it yourself. You just go to ssa.gov, and that stands for socialsecurityadministration.gov. You can go on there applying for Medicare Part A and B, or just Part B if you've already signed up for Part A, or we can help you with that. Or you can go to your local Social Security office if they're open, and they can help you with that. And then again, there's a form, I think it's the next slide, that I'll show you that your employer will fill out for you or your spouse. It's when you sign up for Part B, that gets submitted at the time you apply for Part B, and that's going to prevent any penalties if you didn't sign up at the age of 65. And this is what the employer form looks like. It's just a one-page form. It's request for employment information. You fill out a section, your employer fills out the section saying when your coverage started, when it's going to end. We upload this if you apply online for Part B. You take it with you to the Social Security office if you apply that way. But submitting this form is what's going to prevent any penalties for not signing up when you turn 65. And then the costs of Medicare. These numbers have gone up a little bit too, but if you're high income or if you're low income, you could pay less for Medicare, or you could pay more for Medicare. And by that I mean Medicare Parts B and Part D. Part B is what we covered for the outpatient doctors. Part D is your prescription drug coverage. But for 2023, if your income, if you're a single filer and your modified adjusted gross from 2 years ago, so from 2023, was $106,000 or more, you're going to be issued a surcharge on your Part B premium and your Part D premium. If you're married and filed jointly, if your tax returns from 2023 show that your income for the married couple was $212,000 a year or more, they're going to add on a surcharge to your Medicare Part B and D. And again, we'll go over all this with you, but if you have a financial planner, most financial planners are probably well aware of this. They should be, and advising you of when and so forth when you take any distributions. But just to make you aware, if you fall into that income category, they charge that, they'll add that surcharge on every month for the rest of the year, and then every year after that, your income is reviewed. They work with the IRS to look at your tax returns from, it's always going to be from 2 years ago. And if you fall into whatever the thresholds are for income, because they go up every year, they're going to let you know if you pay a surcharge every month for the following year. So, private health insurance options. There are Medigap plans or Medicare supplement plans. There are Medicare Advantage plans. And there are standalone Medicare Part D plans. We'll go over each of those. So a Medigap plan. In Minnesota, we're a little different than a lot of the nation. In most states across the country, they're going to be referred to as Plan F, Plan G, Plan N, Plan K. In Minnesota, we don't name them that way. We have plans that are called Basic, Extended Basic, a copay plan, which is similar to what other states call Plan N, a high deductible plan, which other states call Plan F. With Medigap plans, your benefits don't change from year to year. What they are this year is what they're always going to be. There's no networks when you go with a Medigap plan. Any doctor or facility that takes Medicare will take your Medigap plan. It travels with you when you're leaving the state or the country. And you can, if you relocate to another state, you won't lose your plan. You can keep your plan if you want to. The downside to that is Minnesota has some of the highest rates in the country for Medigap supplement plans. Whereas if you had a Medicare Advantage plan and you moved to another state, you would be forced to find another plan. So if you moved to Arizona, let's say, you could either find a Medicare Advantage plan in Arizona, or you could get a supplement plan in Arizona at a cheaper rate than what you would have if you bought it in Minnesota. So those are some of the differences with Medigap plans. If you don't join one after in the first 12 months of getting your Medicare Part B, they will ask you health questions if you try to join one. But again, that's changing like I talked about. There'll be an annual enrollment period for Medigap plans in Minnesota. If you're watching from another state, it's likely your state doesn't have that, but in Minnesota, that's going to go into effect. Any questions on that? I met with a Mayo retiree. He's getting ready to retire, and for some of you, you have to use VIA benefits. There's an organization Mayo uses called VIA Benefits. If you started working for the Mayo Clinic in 2001 or earlier, you'll need to go through the company called VIA Benefits because they offer you health reimbursement money, so much per year. That's if you work for the clinic. If you work for the Mayo Health System, the benefits don't apply to you. But if you work for the clinic and you started 2001 or earlier, you'll go through a company called VIA Benefits. Unfortunately, the gentleman I talked to, he was talking to a VIA Benefits person in Texas, and they aren't as well versed on plans in Minnesota. And I'm not putting VIA Benefits down because I've had people tell me they're wonderful to work with. But he was looking at a Medigap plan, and he was told by VIA Benefits that he only had two options, United Healthcare or Blue Cross Blue Shield. And I said, well, that's not accurate. And then she told him that he only had two options within those insurance carriers. And I said, well, actually, Blue Cross has 7 options for Medigap plans in Minnesota. And then he was saying, well, it was my understanding I could get a Medigap plan where you don't have any copays. You're going to pay a higher monthly premium, but you don't have any copays. He said, she told me if I went to the hospital, my copay would be just under $1,700. And I said, well, it would. I said, did she not tell you about the riders? You can add on riders to cover those sorts of things. I don't think she was aware of that. But I'm happy, if you have to use VIA Benefits, I guess is my point, we're still happy to meet with you. And if you're not confident the information you're getting from them is accurate, sometimes it is, sometimes it isn't. We're here to, we can advise you on that. With Blue Cross of Minnesota, you can add on, if you went with they have a plan called Senior Gold. And if you do the riders, they have a rider for $36 a month that'll cover that $1,700 hospital deductible. Well, this was a gentleman who has a history of going to the hospital, history of cancer. He knew he would be going to the hospital. It's like $36 a month versus $1,700. I think you want to do that. If you wanted preventive care for $1 a month, it'll cover your preventive care. So there's things like that in Minnesota that advisors in other states may not be well aware of. But again, we're here to help you if you're in that situation and just want advice on those types of things. If you don't want to go with a Medigap plan, we also have Medicare Advantage plans. Medicare Advantage plans in some states do not have a very good reputation. Their networks tend to be limited. I can tell you, I've been doing this for 17 years, Minnesota has probably the best Medicare Advantage plans in the country. We have insurance carriers where 97% of providers are in the network, and that's even for border states, like if you're going to, maybe you're going to Wisconsin, or that would be for those of you who maybe are in La Crosse or other areas, but 97% of providers are in network with some of the plans in Minnesota. Most of the Medicare Advantage plans, they all have very strong networks. With them, for one monthly premium, you're going to get your medical coverage, your prescription drug coverage, dental, vision, hearing, free gym membership, over-the-counter benefits. There's a lot of extras you get with Advantage plans, and we can help you with that. You will have a network if you go with a Medicare Advantage plan. And again, like I said, those are things we're going to check on with you. If you meet with us, I'm going to ask you what providers you're seeing, what clinics, doctors, dentists, eye doctor, all of that. And we're going to help you find a plan if you choose to go with an Advantage plan that's going to work with you with all your providers in network. We'll look up your prescription drugs to make sure whatever plan you choose is going to give you good coverage for that. There's a difference within Medicare Advantage plans. In Minnesota, we have HMO plans, or health maintenance organizations, or PPO plans, preferred provider plans. Nowadays, I tend to keep people out of HMO plans because you have a lot more restrictions if you go with an HMO plan. You're limited if you're traveling on where you will have coverage. Oftentimes you'll need a referral to see a specialist and those sorts of things. Whereas if you go with a PPO plan, You don't need referrals to see a specialist. They're going to give you coverage all across the country when you're traveling. And so there's just a lot more flexibility when you're looking at Medicare Advantage plans between PPO and HMO. You can enroll anytime during a valid enrollment period. Your benefits and premium can change from year to year. There hasn't been a lot of huge fluctuation in pricing on Medicare Advantage plans in Minnesota over the years. Medigap plans, the premiums go up every year. With Medicare Advantage plans, some plans went down this year, some plans went up. Any questions on that? Then, if you go with a Medigap plan, you would want to add on standalone prescription drug coverage. So this can be paired either if you just want original Medicare Part A and B and prescription drug coverage, or a Medigap policy. Each company's formulary is going to be, and network are going to be unique. So a formulary is going to be a list of the medications that that insurance carrier covers. Medicare requires every insurance carrier to cover every category of medication. Some companies are going to cover brand names. Some are going to be more just of the generic brands. So when we look up your medications, we're going to be able to show you, whether it's an Advantage plan or a standalone plan, which plans give you the best coverage for your medications. There were major changes this year to prescription drug coverage within Medicare. Medicare is requiring your costs to be capped at $2,000. So once you've, and those aren't true costs, I'll say once you've paid $2,000, then the insurance carrier has to cover your prescription costs at 100% for the rest of the year. But the $2,000 isn't true. It's based on a national formula, and for most people, they're not going to actually have paid out $2,000. But when you reach that level, you'll no longer have to pay for your prescriptions. If you're on expensive medications, not everybody's going to encounter that because their prescription medication costs aren't that high, but for a lot of people they are. And when we meet and I enter your prescriptions, I'm going to be able to show you, based on the month you start your plan, to if you reach that level, when you're going to stop paying for your prescriptions, and the insurance carrier is going to have to pay 100%. Because of that, the prescription drug plans changed a lot this year. Insurance carriers added on deductibles, some, not all. They added deductibles, and instead of straight co-pays, especially for Tier 3, they made it a percentage of the cost. So for example, if you were taking Januvia or Eliquis or Ozempic, something like that, those are Tier 3 medications. Some companies, you would have to pay a deductible of $300-400 before your copay kicked in. And instead of having a flat copay, there are some companies that are going to charge you 25% of the cost of those medications until you hit your cap. Other companies, they don't have a deductible, and for Tier 3, you only have a $47 copay. So if you're someone who's taking a Tier 3 medication, you know most of them are going to be $600 a month or more, some double that. You probably don't want to be paying 25% of the cost for your medications on those types of things. So we walk you through all those types of things and help you decide which plan is going to work best for you. They all offer mail order service. Tiers 1 and Tier 2 are typically generic medications. Again, Tier 3 are going to be brand name or more expensive generics. And Tier 5 are specialties. Some insurance carriers have a Tier 6 level. That's the least expensive generics. Not all have that one. There is a late enrollment penalty if you don't apply when you're first eligible. But again, if you're on an employer plan and you wait to delay your enrollment in Part A and B, that form that we looked at earlier that your employer fills out for you, this will prevent you paying a penalty on your Part D. We talked about, it's called IRMA, surcharges for people who have higher incomes. And again, if you are going to delay your Medicare, you want to make sure your employer plan is deemed creditable coverage. If you're on the Mayo plan, they are deemed creditable coverage. And they send you a letter every year, usually in October or November, letting you know if your plan for the next year is going to be creditable coverage or not. So most of you would have received something like that. Any questions on that? Okay. And last year and in previous years, there was something called the donut hole. And I only keep this slide in here because I get asked the question all the time. The donut hole has gone away this year. That was a part of the Affordable Care Act, and they helped lower the donut hole, but there was different stages to prescription drug coverage. The first stage, if your coverage has a deductible, you'd have to pay a deductible for your prescription drugs. When you go to the pharmacy, if you have a $400 deductible, you're going to have to pay the full price for your medications until you've paid out that deductible of $400. If your plan has that, once you've done that, then there's the stage 2 initial coverage, where you have set co-pays or co-insurance that you would pay when you pick up your medications. Stage 3 has gone away this year. There's no longer the coverage gap or the donut hole. In the past, you had to pay, if you reached the coverage gap, you'd pay 25% of the cost of your medications, up until you and the insurance company together had paid out $5,030. That's gone away. You don't have to worry about that anymore. Then stage 4, the catastrophic coverage. That's what changed for this year. Once your medication costs have reached that cap of $2,000, you will no longer have to pay for the cost of your medications. The insurance carrier is required starting this year to pay the full cost of your medications. One of the additional benefits of this new law that went into effect is, for some people, they're going to hit that $2,000 cap in the first 3 months because of the medications they're on. They could hit it in January, February, March. And if you have to pay out that amount of money, that could be a hit when you're on a fixed income in retirement. Well, another requirement that the insurance carriers have starting this year is you have the option of going on a payment plan. If you determine you don't want to pay that chunk right up front in the first few months, the insurance carrier will send you a letter saying, if you fill out this application, we will put you on a payment plan, and instead of you bearing that cost in 3 months, they'll spread it out over 12 months. And if you choose to be a part of that, instead of paying for your prescriptions at the pharmacy, you'll pay monthly to your insurance carrier. So if you sign up for that plan, if it works for you, if that's something you want to do, you go to the pharmacy, you're not going to pay anything for your medications at the pharmacy. You'll be paying your insurance carrier each month. That's new for this year. Okay, costs of Medicare. Again, Medicare Part A, you don't have a premium for. Medicare Part B went up to $185 a month this year. And then Medicare Part C, or Medicare Advantage plans in Minnesota and across the country. Every state has 0 premium Medicare Advantage plans. In Minnesota, they start at 0 and they can go up to $100 or more. Again, these are going to give you coverage for medical, prescription drug, dental, vision, hearing, fitness, free gym memberships. There's a lot of extras you get. Or you can go with a Medigap plan. Your Medicare Part A and Part B premium are the same. Medigap plans, you're going to pay anywhere from $75 to $300 or more, depending on the type of Medigap plan, if you go that route that you want. And then you would need to add on prescription drug coverage, and those plans run anywhere from $0 a month to $100 or more. So you can see, if you add up the math, Medigap plans tend to be more expensive, but there are reasons why some people want to go with a Medigap plan over a Medicare Advantage plan. And again, if you meet with us, we're going to talk through that process, and hopefully will feel good about the decision you make by the time that we finish our consultation. So that's the basics of Medicare. I don't know if any of you have questions, but again, if you want to schedule a time, if you fill out that gray card that's in your folder, if you do, please put an email address. The first thing we're going to do is send you an email asking when are you going to turn 65 or when are you going to retire. You'll respond, and then we will contact you within 3 months of that time frame. We're not going to be beating your door down trying to get you to do something until you're ready to do it. But we will be in contact with you if you want to use us for that. Again, using us, it's complimentary. You never pay us anything. If you end up signing up through a plan through us, we get paid by the insurance carrier. But we are here because we're owned by the Minnesota Credit Union Network. The Minnesota Credit Union Network is a nonprofit, and we're here to help members, credit union members, or we help anybody who needs help with Medicare. But our first goal isn't to make a ton of money, it's to help our members. So if you have to use Via Benefits, and again, you may get very good advice from Via Benefits, but if you question that advice, you can always call us and we can meet with you to review things with you, just so that you have peace of mind. We're here to help you with that. So with that, I don't know if there are any questions online or in person. Easiest audience all week.
Well, we have questions, but I think we're going to
Okay,
make an appointment.
okay. And I'm here afterwards too if you don't want to ask in front of everybody. But yeah, if you want that, if you fill out that form, just make sure I get it before you leave. But you have my contact information in there. You're welcome. Oh, let me advance to that for the people online. So my email address is dbrown, for Dave Brown, dbrown@mncun.org, and that stands for Minnesota Credit Union Network. And my direct cell number is there. We also have Michaela and Chris who work for the agency. We have other agents too, but we're the team that runs the agency. And you're welcome to contact us, email, voicemail, texting, whatever you want to do, a phone call, and we will be here to help you. So with that, I'll say thank you for coming. And again, I'll be here if you have questions you want to discuss after.